Hattiesburg. Thanks for joining us for this COVID-19 briefing for Wednesday, December 2nd. We'll start with today's numbers. These are system-wide numbers for all of our healthcare organizations. As of this morning, we'd seen 91,643 tests conducted, with 10,169 coming back positive, 80,794 negative, 680 tests currently pending. In the hospital today, we have 91 patients who are COVID positive between Mary Health Wesley and Forrest General. That's 15 everywhere we've been for the last 2 weeks. And of those 91, now 32 are in the ICU, which is 12 over where we've been for the last 2 weeks. As you can see, it's been this is a new mark for us in terms of this current surge. We'll talk about that in just a second. Statewide data, 2,457 new cases. That's a record number of cases for a single day in Mississippi with 15 new deaths. And in our area, a big increase for both counties. Forrest County added 50 new cases. Lamar County added 41 new cases to our metro area total to 91 in a single day. Since this began, Forrest County has 3,947 total cases. Lamar County, 3,019 total cases. Our 5-day average, Forrest County got up to around 40 at the end of last week. That number's now dropped to right at 30. Lamar County right at 25 right now. The inside 14-day number is the number of people who have received their positive test result within the last 2 weeks. It gives you a reasonable indication of how many active cases we could have in our community. Right now, that number's at 457 for Forrest County and 389 for Lamar County. What's a particular concern is we're hitting some new marks now in terms of those overall active cases. Really, in both counties are getting up to places that to highs. They're approaching the sort of record highs for both of those numbers. Just compared to a week ago, we had 406 inside 14-day in Forrest County. Today, that's at 457. Lamar County was at 297 a week ago. They're now at 389. So an increase of nearly 150 for our metro area. Up at 846 potentially active cases right now. Hospitalizations have also seen a big jump. A week ago we were at 73. That number's now at 91. ICU admissions 19 to 32. Our goals continue to be overall protecting vulnerable populations, people that are over the age of 60, people with underlying or chronic health conditions, trying to prevent overrun of the healthcare system by slowing the spread, and of course prioritizing public health while giving the private sector the space it needs to operate. We lean on 4 things to do those goals: widespread availability of testing, wearing masks, watching our own data, and of course listening to all voices. Of course, on Wednesday we have our weekly conference call with our hospitals, Hattiesburg Clinic, our universities, our schools, our emergency management personnel. As of this morning, positivity rate continues to be up. In fact, this is just Hattiesburg Clinic numbers right here. We hit 16.2% positivity rate, percentage of total tests coming back positive, which was an all-time high. And aside from just Hattiesburg Clinic's positivity rate, I had the opportunity to talk to Dr. Byers at the health department last night, and we're seeing higher than normal positivity rates at the health department testing in our area as well. Another thing we watch is the percentage of new cases under the age of 20. While we don't want anyone to get COVID, if a lot of those are coming from folks who are students, whether high school or college, you're less likely to see new cases translate into hospitalizations. However, what we are seeing is quite a low mark right now in terms of the percentage of new cases coming to those people under the age of 20, which would then, this next slide, point to the average age of new positives is actually going up. Of course, people who are older have a tougher time getting over this. And so when we had the surge in early October, the average age was 36.5 because such a high percentage were students. But since then, you've seen fewer students getting that and more people who are up there in age. And so last week the average age was at a high too of 46.2. And so higher positivity rates and higher average ages will likely continue to push hospitalizations. We're seeing that right now because hospitalizations have passed 90 for the first time over the weekend since early August. We haven't seen that level of hospitalizations for COVID since that summer surge. Furthermore, for a while there, hospitalizations were not turning into ICU admissions, but now they are. So ICU admissions have passed 30 for the first time since early August. That happened today. What we really worry about, aside from all those people who are in the hospital who could have a tough time getting over this, is the effect it's going to have on bed capacity when it comes to taking care of sick people, either for COVID or some other reason. As of this morning, Forrest General had 10 acute beds available, 1 ICU bed available. Meredith Wesley, as of this morning, had 8 to 12 acute beds available. They were already 2 over their initial ICU capacity, but they can expand to an additional 4 to 6 ICU beds if needed. Now, the thing to remember about bed capacity is it changes throughout the day. So in the morning, you typically see a lot of patients being discharged, but then as surgeries happen, as ER visits go up, you'll see people admitted throughout the afternoon. And so we really don't have an idea on what bed capacity is until the very end of each day to know how many beds we have available. But it goes without saying that if we continue to see higher number of COVID patients going into the hospital, you're likely going to see fewer beds available for those who need health care for other things or for trauma situations. Just so you know, however, we want to remind you there are plenty of places to get tested in the city of Hattiesburg. Of course, Hattiesburg Clinic's Cough and Fever Clinic is available by 49 South Walmart. Meredith Health Wesley has all of their outpatient clinics who are doing COVID tested. I know there are several private clinics doing COVID testing. However, we want to let you know that CEOI Community Center, that's the testing center that the city supports financially. That's available Monday, Wednesday, Friday, 8 to noon at CEOI Center on East 5th Street. The Lamar County Health Department will have drive-through testing tomorrow at their Purvis office. And then Forrest County Health Department will have that drive-through service available on Friday. Now, for both the Lamar County Health Department and the Forrest County Health Department, you do have to schedule your visit in advance by going to covidschedule.umc.edu. We also want to let you know that on December 12th and 13th, as we get deeper into the holidays, Forrest County Emergency Management will do a mask and hand sanitizer giveaway at their office at 4080 US Highway 11. That'll be 8 to 5 on December 12th and 13th. However, if you are shut in or know someone who is disabled who cannot get out, that number is 601-544-5911, and they will deliver a mask and hand sanitizer to you. Finally, our act of courage. Throughout this pandemic, several organizations and public office holders have held events to try and get masks and meals out to people. One of those is Councilman Nick Brown, who has done usually a summer, a winter day in the park. He converted that to a kind of a drive-through activity this year. And he's doing another one this Saturday in Palmer's Crossing at DeWitt Sullivan Park. So from 2 to 4 p.m., you can drive through, grab a meal and a mask from courtesy of Councilman Nick Brown and sponsors. So we encourage you, if you need one of those or know someone who does, December 5th, this Saturday from 2 to 4 p.m. We appreciate Councilman Brown and all of his sponsors for making that possible. As we continue on in this week, remember to wash your hands, take care of yourself mentally and physically. Please wear a mask if you go out in public. Do only what is essential. And remember, especially right now, you're safer at home. Have a great evening.